Steve, we've talked about urinary and fecal incontinence. There's a number of products there that you might want to comment on as well, Sharon or Joe.
Yeah, well, there are lots of what we call containment products. So you get, the pads that you can pop into your undies. You get like pull-up type pants, as well as bed and chair protectors and things like that. And they work really well for for urinary incontinence, but not so well for the fecal incontinence. As we mentioned earlier, the pads that generally are available, although some of them are made for fecal incontinence, and by that I say that they have like a charcoal layer to help with odor control. Anything that's even sort of slightly thicker than urine doesn't get absorbed into these pads and pants quite as well and quite as quickly as urine does. Pads come in all shapes and sizes, from tiny little shields for men that are male-shaped, right up to things that look like huge adult nappies. The big adult nappies tend to be for people who are bedbound, so probably not your client group. And there are some that are mostly available in the shops, Coles, Woolies, chemists, etc., are disposable. But there are some washable ones out there. So I suppose it really depends on the patient's preference and what their independence-wise circumstances are for washing and things like that. For male urinary incontinence, there obviously can be catheterization, which most men who've had prostate surgery would say that that's probably been one of the worst things about the whole surgery journey. Well, certainly in my experience with the men that I've talked to. But it's not something that we would take lightly to use for incontinence is catheterization, because of that risk of infection, because it is an invasive device. So there are urinary sheaths, which basically is like a sticky condom that rolls onto the penis with adhesive, has a hole on the end, and it gets connected to a bag, and that can be worn on the leg, or it can be left at the side of a bed, or whatever the circumstances are. As well as using things like commodes over the toilet frames, etc., for those people who are having more of an issue with what we would call functional incontinence. And functional incontinence is when they just don't have that functional ability to get to the toilet in time to be continent. So there are far too many different types and brands out there to even begin to go into specific ones. But they're mostly readily available in your supermarkets, etc.
So let's talk about the incontinence products, particularly now. There's also washable ones that you've mentioned. They hold, I think, 1 to 2 drops, or maybe 5 mils. Denis, has anyone talked about that in your group, about washable briefs or boxers briefs at all?
Not the washable ones, no.
No.
In fact, I hadn't heard about them until fairly recently. Okay. So I don't know whether they're a new product on the market, but they are not talked about. Most of the talk in our groups is about the disposable pads, which, as Sharon has said, come in different sizes, shapes, and can hold different amounts of liquid. So, the washable ones are something new for me.
Yeah, they certainly are, and they are also a bit more expensive. So let's have a look where we can get some help for those. So, Sharon and Joe, anyone else they need to be reaching out to insofar as financial assistance?
Look, there is financial assistance. Some of the schemes really have really strict criteria for the patient to be eligible. So, obviously as a nurse, we would say, I would say a Nurse Continence Specialist is probably the best person to see. They have more of a knowledge about what's actually available out there. And they are, there's an assessment done about how much incontinence there is, what different types, when, etc., and that builds up a picture about what is really required for that individual patient. And then we can sort of help them, point them in the right direction about what they want. Again, we teach people how to wear these products. As a nurse who has spent a lot of time removing catheters from post-prostatectomy patients, a lot of men are quite, blown away by the fact that the sticky bit on the pad does actually stick to their underpants and not to their penis. Which as a female I find really odd, but I mean, that's just, women are more sort of tuned to wearing pads and things. And you don't know what you don't know. So, we teach the patient how to wear the product, let them know basically what that sort of, the capacity, and, for changing, etc. Now, there are a couple of schemes that help with financial aspects of things. There is the Continence AIDS Payment Scheme. Now, that is a federal scheme that essentially is run by Medicare. It's got quite strict criteria. It's more neurological conditions, but there are two categories that men who have had prostate cancer or suffering from any kind of incontinence really can be enrolled into these schemes. One of the categories, unfortunately, is dependent on whether they have either a healthcare card or a concession card. But we do our best to try and make sure that they fit into one of the criteria so that they can get some help. There are some state and territory schemes, and unfortunately, my short availability of looking at research, I couldn't actually find the names of the different schemes in different states. The one we have in WA is called CMAS. That is the nursing side of that, is run by Silver Chain, although there are lots of what we call external continence nurse referrers out there who can do the assessment, help them choose the right product, etc. I think from memory, it's about $490 worth of products. You only get products from this scheme, whereas with the CAP scheme, you get actual money into your bank account, and it comes from Medicare, and then that allows you to go and buy the whatever product it is that you feel that you fits you best, what you want, and what your preference is. And of course, there is the DVA, the Department of Veterans Affairs. So men and women, obviously, that have a gold card, they can have their continence products ordered through a continence nurse or a doctor or a physiotherapist, things like that. And they just get their, the pads that they need. I think it's just recently that people with a white DVA card, if their diagnosis has got anything to do with cancer, then they are also covered too. So, there is a lot of help out there, but sometimes the criteria is very, very strict. And, you say $490 worth of products a year. When you actually count that up, it's not enough. And quite often people are dependent on both of those schemes to provide enough products that they can use and need.